So, good afternoon. My name is Dirty Luis Sanchez. So, I'm gonna teach you about obesity. So, here are some flyers that you can read. So, obesity. Obesity is a complex disease involving an excessive amount of body fat. Obesity isn't just a cosmetic concern, it is a medical problem that increases your risk of other diseases and health problems such as heart disease, diabetes, high blood pressure, and certain cancers. So, what causes obesity? Obesity is generally caused by eating too much and moving too little. If you consume high amounts of energy, particularly fat and sugars, but do not burn off the energy through exercise and physical activity, much of the surplus energy will be stored by the body as a fat. Calories. The energy value of food is measured in units, called calories. The average physically active man needs about 2,500 calories a day to maintain a healthy weight, and the average physically active woman needs about 2,000 calories a day. Next, poor diet. Obesity does not happen overnight. It develops gradually over time as a result of poor diet and lifestyle choices, such as eating large amounts of processed or fast foods that are high in fat and sugar, drinking too much alcohol, and eating a lot. Eating larger portions that you need, drinking too many sugary drinks, and comfort eating, and unhealthy eating habits tend to run in families. You may learn bad eating habits from your parents when you're young and continue them into adulthood. Lack of physical activity is another important factor related to obesity. Many people have jobs that involve sitting at a desk for most of the day. They also rely on their cars rather than walking or cycling. Gets nyo, di ba? Mas more on transportation na lang kaysa sa physical na mga tao ganyan. So next, genetics. Yan, sa genes. Some people claim there's no point trying to lose weight because it runs in my family or it's in my genes. While there are some rare genetic conditions that can cause obesity, such as Prader-Willi syndrome, there's no reason why most people cannot lose weight. It may be true that certain genetic traits is inherited from your parents, such as having a large appetite, may make losing weight more difficult, but it certainly does not make it impossible. Yeah. Medical reasons. In some cases, underlying medical condition may contribute to weight gain. These include an underactive thyroid gland, hypothyroidism, where your thyroid gland does not produce enough hormones. Cushing's syndrome, a rare disorder that causes the overproduction of steroid hormones. However, if conditions such as these are properly diagnosed and treated, they should pose less of a barrier to weight loss. And diagnosis, obesity. Body mass index, or BMI, is widely used as a simple and reliable way of finding out whether is a healthy weight for their height. For most adults, having a BMI of 18.5 to 24.9 means you are considered to be a healthy weight. A person with a BMI of 25 to 29.9 considered to be overweight, and someone with a BMI over 30 is considered to be obese. While BMI is a useful measurement for most people, it's not accurate for everyone. For example, the normal BMI scores may not be accurate if you're very muscular, because muscle can add extra kilos, resulting in a high BMI when you're not an unhealthy weight. In such cases, your waist circumference may be a better guide. Visiting your GP or general practitioner. If you're overweight or obese, visit your GP or general practitioner for advice about losing weight safely and to find out whether you have an increased risk of health problems. Your GP may ask about your lifestyle, given nyo sa yung kung exercise ka ba or diet ka. Particularly your diet and how much physical activity you do. They also ask you whether you smoke or drink alcohol. Any possible underlying causes for your obesity, for example, if you're taking medication or have a medical condition that may contribute to weight gain. So, how do you feel about being overweight? For example, if it makes you feel depressed, how motivated you are to lose weight, and your family history, as obesity and other health conditions such as diabetes are often more common in families. As well as calculating your BMI, your GP may also carry out tests to determine whether you're at increased risk of developing health complications because of your weight. And this could include measuring your blood pressure, glucose or sugar, and cholesterol levels in a blood sample, waist circumference, the distance around your waist. People with very large waist, generally 94 centimeters or more in men and 80 centimeters or more in women, are more likely to develop obesity-related health problems. Your GP may also take your ethnicity into account because it can affect your risk of developing certain conditions. For example, some people of Asian, African, or African Caribbean ethnicity may be at increased risk of high blood pressure or hypertension. Healthy waist measurements can also be different for people from different ethnic backgrounds. After your assessment, you'll be offered an appointment to discuss the result in more detail. Ask any questions that you have and fully explore the treatment options available to you. Treatment for obesity. If you're obese, speak to your general practitioner for advice about losing weight safely. Your GP can advise you about losing weight safely by eating a healthy, balanced diet and regular physical activity and pag-exercise, pagbawas sa pagkain. They can also let you know about the other useful services such as local weight loss groups. They could be provided by your local authority, the NHS, or commercial services you may have to pay for. Exercising prescription, where you are referred to a local active health team for a number of sessions under the supervision of a qualified trainer. If you have underlying problems associated with obesity such as polycystic ovary syndrome or PCOS, high blood pressure, diabetes, or sleep apnea, your GP may recommend further tests or specific treatment. In some cases, they may refer you to be a specialist. And diet. There's no single rule that applies to everyone, but to lose weight at a safe and sustainable rate of 0.5 to 1 kilogram a week. Most people are advised to reduce their energy intake by 600 calories a day. For most men, they will mean consuming no more than 1,900 calories a day, and for most women, no more than 1,400 calories a day. The best way to achieve this is to swap unhealthy and high-energy food choices such as fast food, processed food, and sugar drinks, including alcohol, for healthier choices. Yung mga fast food, mga burger, fries, yung mga coke, A healthy diet should consist of plenty of fruits and vegetables, plenty of potatoes, bread, rice, pasta, and other starchy foods. Ideally, you should choose whole grain varieties. some milk and dairy foods, some meat, fish, eggs, beans, and other non-dairy sources of protein. Just small amounts of food and drinks are high in fat and sugar. Try to avoid food containing high levels of salt because they can raise your blood pressure, which can be dangerous for people who are already obese. Yung mga masgad. Yan. Exercise. Reducing the amount of calories in your diet will help you lose weight, but maintaining a healthy weight requires a physical activity to burn energy, as well as helping you maintain a healthy weight. Physical activity also has wider health benefits. For example, it can help prevent and manage more than 20 conditions, such as reducing the risk of type 2 diabetes by 40%. The chief medical officers recommend that adults should do a minimum of 150 minutes moderate intensity activity a week. For example, 5 sessions of 30-minute exercise a week. Something is better than nothing, and doing just 10 minutes of exercise time is beneficial. Moderate intensity activity is any activity that increases your height and breathing rate, such as brisk walking, cycling, recreational swimming, dancing. Alternatively, you could do 75 minutes of vigorous intensity activity a week, or a combination of moderate and vigorous activity. During vigorous activity, breathing is very hard. Your heart beats rapidly and you may be unable to hold a conversation. And so, pag masyadong sobra ng mga activity mo, pag hal-hal na, examples, running, most competitive sports, sa volleyball, basketball, circuit training. You should also do strength exercises and balance training 2 days a week. This could be in the form of a gym workout, carrying a shopping bag, or doing an activity such as Tai Chi. It's also critical that you break up sitting, sedentary time by getting up and moving around. Other useful strategies. Setting realistic weight loss goals. Mga goals mo, gusto mo paliwan na. If you're obese, losing just 3% of your original body weight can significantly reduce your risk of developing obesity-related complications. Eating more slowly and being mindful of what and when you are eating. For example, not being distracted by watching TV. Avoiding situations where you know you may be tempted to overeat. Involving your family and friends with your weight loss efforts. They can help to motivate you. Monitoring your progress, for example, weigh yourself regularly and make a note of your weight in a diary. Avoiding weight regain. It's important to remember that as you lose weight, your body needs less food calories. So after a few months, weight loss slows and levels off even if you continue to follow a diet. If you go back to your previous calorie intake, once you've lost weight, it's very likely you'll put the weight back on. Increasing physical activity to up to 60 minutes a day and continuing to watch what you eat may help you keep the weight off. Medication. Many different types of anti-obesity medicines have been tested in clinical trials, but the only one that has proved to be safe and effective is orlistat. Orlistat works by preventing around a third of the fat from the food you eat being absorbed. The undigested fat isn't absorbed into your body and is passed out with your food. This will help you avoid gaining weight but will not necessarily cause you to lose weight. But orlistat should be used. Orlistat will usually only be recommended if you've made a significant effort to lose weight through a diet, exercise, or changing your lifestyle. Even then, orlistat is only prescribed if you have a BMI of 28 or more, and other weight-related conditions such as high blood pressure or type 2 diabetes. Dosage and duration of treatment. A single orlistat capsule is taken with water immediately before, during, or up to 1 hour after each main meal, up to maximum of 3 capsules a day. If you miss a meal or the meal does not contain any fat, you should not take the orlistat capsule. Your doctor should explain this to you, or you can check the patient information leaflet that comes with your medicine. Yeah. Side effects. Common side effects of orlistat include fatty or oily poo, needing the toilet urgently, pooing more frequently, and oily discharge from your rectum. You may have oily spots in your underwear, flatulence, and stomach pain, headaches, upper respiratory tract infections such as cold. These side effects are much less likely to occur if you stick to a low-fat diet. Women taking the oral contraceptive pill should use an additional method of contraception, such as condom. If they experience severe diarrhea while taking orlistat, this is because the contraceptive pill may not be absorbed by your body. If you have diarrhea, so it may not be effective. Surgery pa. Sa paulisan, paano magpapayat. Bariatric surgery is usually only available on the NHS to treat people with severe obesity who fulfill all the following criteria. They have a BMI of 40 or more, or between 35 and 40, and another serious health condition that could be improved with weight loss, such as a type 2 diabetes or high blood pressure. Yeah. Treating obesity in children. Treating obesity in children usually involves improvements to diet, increasing physical activity, and using behavior change strategies. The amount of calories your child should eat each day will depend on their age and the height. Also, your general practitioner should be able to advise you about a recommended daily limit, and they may also be able to refer you to your local family healthy lifestyle program. Children over the age of 5 should ideally get at least 60 minutes of vigorous intensity exercise a day, such as running or playing football or netball. Sedentary activities such as watching television and playing computer games should be restricted. Yeah, thank you. So I have a few questions for you. So I may be asking. So that's the end of discussion. So I have a few questions for you. So let me ask, what is obesity? Abby.
Obesity is a complex disease involving an excessive amount of body fat.
Okay, good. May mga risks pa doon na pwedeng like sa cancer, high blood pressure, or madami, basta madami. Etc. So, next question. What are the common causes of obesity? Jorian.
Eating too much and moving too big.
Okay. Yan. So, mga buyad, tsaka pakakaaming bakoy lang sayong. So, my last question. What is the treatment for obesity? Yes. Al.
The effective way of losing weight is by eating healthy foods, having a balanced diet, and having exercises.
Yan yung mga best way talaga, mga exercises and diet. Pero may mga other option pa, di ba? Mga kunyari, inom ng mga gamot. Tapos, surgery. Yan. So, yan. Thank you, yan. Nagtatapos ang aking lecture sa inyo. So, thank you for your cooperation. Goodbye.